first part of ultimate pulmonary wellness is medical. Taking the right medications, taking the medications properly, and having the right doctors really means seeing specialists that are tuned up in terms of pulmonary fibrosis and other interstitial lung diseases, because these are complex diseases, okay? Most internists are not going to be tuned up to handle ILD. Even a pulmonologist, this is complex even for a pulmonologist. So you really want to get hooked in with the right team, the right medical center, the right center of excellence that specializes in ILD, for the simple reason that getting the right diagnosis is crucial. Because when it comes to ILD, some of the treatments for some of the interstitial lung diseases are actually detrimental to others. So it's really important that you get the right diagnosis so you can take the right medications and you can take your medications properly. The next 20%, exercise, okay? Exercise is so important. And as I said, when people start to get short of breath, they find ways to avoid the activities that cause them discomfort. The body deconditions. And when the body deconditions, you get less and less, activity, more and more short of breath. I'll put in with this, okay, oxygen use, okay? It's so important. So I started treating pulmonary fibrosis patients in about 1995. And at that time, there was no rehab available for pulmonary rehab, for pulmonary fibrosis patients. Patients came in, they looked sick, okay? They often looked blue or white. They were super short of breath. They looked scary. And what they were told very often was, you are too sick for rehab. So what does too sick for rehab mean? Essentially, it means go home and wait to die, right? Or they would say, you know what, we can't exercise you because you're resting at 88% oxygen saturation, but when you get up, you're now at 70%, right? So what we started doing was, my mentor, Dr. Horatio Pineda, and I started talking about this, and we said, look, if this is the situation, you're either too sick for rehab, or this, we really have nothing to lose by trying to rehab people. So we started exercising people, we started giving people as much oxygen as they need, okay? Even it could be 100% oxygen by mask, which means you're not gonna get that out of a portable concentrator. But what we found was that we started being able to increase people's endurance. We started being able to increase their exercise tolerance. Oxygen saturation improved both with exercise and at rest. And that's kind of how we started learning more and more about how to treat pulmonary fibrosis patients. There are similarities with COPD. There are differences with COPD, but there are much more similarities than differences. Okay, nutrition is so important for people with pulmonary fibrosis. It's important for everybody with respiratory disease, but pulmonary fibrosis really has the ability to make you burn a ton of calories. So people will often lose weight because they cannot get adequate nutrition. Okay, typically, very often people will get short of breath after they eat. Why? They eat. The abdominal contents sit right under the diaphragm. The more you eat, the bigger meals you eat, the diaphragm has to work harder to contract downward. The lungs have to, work harder to expand, and you get more short of breath. The other thing is that a lot of people don't know that carbohydrate metabolism will create the most carbon dioxide of any of the nutrients. So fat will create the least, protein will create the middle amount, but carbohydrate metabolism, the #1 byproduct is going to be CO2. So you eat a high carb meal, and then your blood, your bloodstream sends a signal, your chemoreceptors send a signal to the brain that says breathe, breathe, breathe. So now we've got this mechanical obstruction to the diaphragm moving. We've now got this chemical kind of stimulus to breathe, and that really gets people to where they're uncomfortable when they're, after they eat, leading to more calories being burned and more, less ability to take in calories. And if you don't think that nutrition's important, I really believe that once somebody, kind of gets on that sort of slide, there's like a tipping point. So if, there's a tipping point where it really becomes much more difficult to breathe, and then you start kind of using muscle for energy, which is it's a bad time, okay? So it's really important. And even if you're a little bit overweight, I'd rather people be a little bit overweight and have that kind of reserve for when they need it than to try to lose and become perfect weight and then they can't keep up with the weight, later on down the road. There are very few things that are more stressful than not being able to breathe, right? So we have this cycle of shortness of breath. That may be the first thing, right? We get a sensation, and then that sensation hits the mind, and then the mind puts out chemicals in response to that sensation. And then guess what? We have another physical response, and we get this. And what happens is, I always think of it like this, like people are walking in the street, and it's like if you don't know how to swim, you're not going in the deep end of the pool, right? You're gonna stay out. So if you don't know if you're gonna make it to the grocery store or not, you're not going to the grocery store. And what I think is that a lot of times, people have this idea, and it's like, Sanford and Son, where he's like, Elizabeth is the big one. And, they think that they're going to have a heart attack. They think they're going to pass out. They think they're going to keel over. And not to say it's impossible, okay? Of course you need to work yourself up. You need to get worked up by a doctor, a cardiologist, a pulmonologist to make sure that you are going to be safe. But it's this code red situation where somebody's really out of control, where we need people to say, stop, I know what to do here, to give them a tool to say, you know what, I know what to do, stop what I'm doing, stop adding fuel to the fire, start breathing. And once people do it, it's like when you're teaching a kid to ride a bike or when you're teaching a kid to swim, you say, hey, I really can do this. And that's how confidence grows. And you can walk a half a block today, and tomorrow we're gonna walk a block, and then we're gonna walk a block and a half. Little by little by little. Prevention of infection is avoiding sick people, washing your hands a lot, wearing a mask if you're going to have exposures, to certain things. And by doing those 5 things, and hopefully over time the medications will get better and better and better, and hopefully there will be a cure. But again, like I said, the revolution is coming, the cure is coming. Yeah, you can hope for a cure, you can pray for a cure, okay? But until that cure comes, all the same things that are going to make your life better are going to make you more ready for the cure.